Okay, this is Chapter 10, Rheumatologic Disorders. I picked this chapter because I have a lot of personal as well as family history with a few of these diseases. This chapter is going to talk about the differences between osteoarthritis, rheumatoid arthritis, systemic lupus erythematosus, and gout. Okay, so first we're going to talk about osteoarthritis. It is the most common form of arthritis in the United States, and it's non-inflammatory, and it's characterized by degenerative changes, meaning just a breakdown of your joints over time. This is a slide that shows a normal joint and a joint affected by osteoarthritis. Here's some risk factors that would either cause you to have or make you more likely to have osteoarthritis: your age, prior injury or trauma, obesity. Here's some signs and symptoms, or things that you would look out for if you think you may have osteoarthritis: pain involving one or only a few joints, limited range of motion, stiffness, subluxations or dislocations. Your physician should be able to diagnose this just on exam alone, but may want to do lab testing or x-rays. The treatment goals are to improve function and quality of life for your patient. Always education. You can also use things like non-steroidal anti-inflammatory drugs. If those don't help, then they usually go to a little bit stronger drugs like Celebrex. They can also do injections, like corticosteroid injections directly into the joint, which don't feel good. And also there's topical. The next type of arthritis we're going to talk about is rheumatoid arthritis. This is an autoimmune disease, which means basically your body attacks itself. So this attacks the synovial fluid in the joints and causes more swelling and inflammation, mostly in women than men, and it happens later in life after about your childbearing years. It is something that never goes away, but it is treatable. So you can treat it, it flares, it goes back and forth, and ultimately destroys your joints. The signs and symptoms that you'll find with this is pain, swelling, fatigue, tenderness, redness, pain when you touch. It can be in your hands, wrists, arms, shoulders, feet, ankles, toes. You can also get nodules that feel like little cysts, like in the bottom of your feet or in your hands. This is the classification criteria to diagnose the disease. If you have morning stiffness that lasts longer than an hour, swelling in 3 or more joints, usually in the hands, or symmetrical, a positive rheumatoid factor, which is a blood test that they would take, and it's positive in 80% of patients with rheumatoid arthritis, but it does not indicate that they actually have the disease. So with that being said, you could have a positive rheumatoid factor but not actually show signs or symptoms. To manage this disease, you give the patient medications that either help prevent or stop, or both, the damage of the joint. They would take something like ibuprofen or Celebrex, nonsteroidal anti-inflammatories again. Also, a lot of times you have to use corticosteroids like prednisone. And then there's another drug or classification of drugs called disease-modifying anti-rheumatic drugs. These are the drugs that help stop or slow down the joint damage process. You want to start your patient on these particular drugs as early as possible to help stop the damage of the joint. These are either injectable or they are given intravenous at the doctor's office or at an infusion center. Next, we're going to talk about lupus. This is another autoimmune disease that affects mainly women in their childbearing years. The disease is marked by exacerbations, remissions, flare-ups. It can be life-threatening because it affects numerous organs in your body. The kidney in particular, the liver, nervous system. Family history is a strong risk factor for developing the disease. With lupus, you can have a mixture of different symptoms, from fatigue to fevers to skin rashes. That's why I put the picture of the lady with the butterfly type rash on her face, musculoskeletal pain, and mild hematologic involvement. With some patients have more severe complications involving their kidneys, or I didn't know this, neuropsychiatric. Here's the classification criteria. It's going to talk about different types of rashes that you may see, or photosensitivity, sensitivity to the sunlight, ulcers in the mouth, arthritis, renal disorders, neurologic disorders, hematologic disorders. Management of the disease is similar to that of rheumatoid arthritis, in which you have to take medications pretty much for the rest of your life, in order to keep it under control or keep it in remission, to stop or lessen the effects it may have on your other organs. The last one we're going to talk about is gout. And gout is pain that's caused or characterized by monosodium urate crystals that are found in the joints or the soft tissues. It's a buildup of uric acid. Most men get this, and it's in men older than 40 years of age, and it usually presents about 20 years after puberty. There are 4 different phases of gout, and they are right there for you. Let's go through the signs and symptoms. I put that big toe up there because it just makes me crack up. But most of the time when you hear people complain about gout issues, it's their feet or their toes that hurt when they try to bend them or walk or even pull covers over the top of them. So it's a joint pain with swelling, often occurring at night, and most of them are in the toes, like I said, and it's pain that will last for 5 to 7 days. It can affect other joints, like your foot, knee, ankle, wrist, fingers, and elbows. A definitive diagnosis can only be made with the aspiration of synovial fluid. And I don't know about anybody else, but I think I'd just take the doctor's word for it before I let him stick a needle in part of my toe or foot that's throbbing with pain. The management and treatment of gout is to control the attacks and prevent reoccurrence. To treat acute attacks, they usually use nonsteroidal anti-inflammatories, naproxen, ibuprofen. They also will use colchicine or allopurinol to prevent chronic arthritis. What that does is helps get rid of the buildup of uric acid. Diet is also key. They want patients on a high purine diet, no alcohol, and to exercise, reduce red meat and seafood consumption. This concludes my chapter presentation, and hope you guys enjoyed and learned something.